everyone, my name is Becky Watson and I am here to discuss my project proposal for NSC 892. During this video, I will define a healthcare problem, review some of the evidence to support my proposed project. I will also talk about the significance to advanced nursing practice and talk about some of the literature I reviewed, the plan, and some of my outcome measures. So to begin with, I have a poster presentation here, internet-based cognitive behavioral therapy for depression. The clinical nursing problem I will be discussing is depression. Every year, depression is increasing. There are some statistics on the poster, and it talks about how the Healthy People goal for 2020 was to increase the treatment expansion for depression. Some of the background and significance listed on the poster. It talks about my literature search, which search engines I used. I found about 20 articles that I reviewed, and of those I reviewed 4 of them in depth and used that data during my integrative review. Also, methods, talked about how we chose participants. We chose people over the age of 18 who had mid-range depression scores, who did not have any suicide attempts or suicidal ideation. Those people were excluded if they did have those types of behaviors. Also, the clients had to have reliable internet access to be a part of the proposed study. On the poster, I also have a NAT chart which describes the tasks and timelines of the 5-month period of time that the study would be occurring. During the first month, of course, we would do recruitment of the participants and recruitment of the providers and researchers that would be needed for the study. During months 2 through 4, we would do the internet-based therapy. During that time, providers would be providing data back to the leadership team with data information, including anyone who had dropped out of the study, any problems that had occurred, and of course, at the end of the therapy, the providers would be reassessing depression scores using Beck's inventory, and the goal, of course, is that we would see a lower depression score at the end of internet-based therapy. That is the objective of the proposed study. So at the end, we would reassess. Of course, we would hope for lower depression scores. A lot of our literature that we reviewed prior to the study states that face-to-face therapy, cognitive behavioral therapy, and internet-based cognitive behavioral therapy had similar reductions in depression scores. So, of course, that would be our expected outcome for our proposal. The implications and conclusions of the study, of course, there's a lack of mental health providers, especially in rural areas. And one of the biggest implications would be that we would be able to reach clients that need depression therapy. We may be able to reach people that are unable to come to a clinic appointment for reasons of transportation or finances, or the stigma attached to getting mental health help in some areas. So those things wouldn't be a hindrance to some patients. They could receive the internet-based therapy. The provider would be there on the screen for them. They could receive the therapy, and possibly, it could help with their depression. Mental health nurse practitioners need to stay abreast of this kind of technology because it is the future, and a lot of healthcare, mental and physical, other physical types of healthcare, will be done via internet-based types of care. So we need to stay abreast of that. We're going to be frontline providers for this kind of therapy. So it is something that we need to keep up on the research, make sure that it is something that is actually helping the clients, and be sure that we are able to provide those kinds of services if that is what the client needs. If that's the only type of therapy that person can get to, we need to be able to provide that to them. Thank you for listening to my video, and thank you for taking a look at my poster that I created. Thank you. Goodbye.